Hi, and welcome to the Bouncing Back Podcast, Professionals Thriving with Chronic Illness. I'm Melissa McCurley, your host, and someone navigating life and business with the challenges of autoimmune disease. This podcast is about resilience, inspiration, and actionable strategies to help you thrive, no matter where you are in your health journey. In each episode, we'll share stories and insights from professionals who've bounced back stronger. Let's redefine what it means to live and thrive with chronic illness. Now, let's dive in. Hello, and welcome to the Bouncing Back Podcast. I'm your host, Melissa McCurley, and I am super excited to introduce you to our special guest today. His name is Dr. Thomas Cziao, and he's a holistic dentist specializing in biological dentistry, which if you don't know what that is, stay tuned because you want to learn. This has a huge impact on health for the chronic illness community, people dealing with inflammation, autoimmune, and fatigue. So without further ado, let me introduce him. And welcome to the podcast, Dr. Cziao.
Thank you for having me today.
We're so glad you could be here.
Same here. I'm looking forward in helping people to learn more about the biological dentistry and introduce them to this field.
Yeah, so let's just assume that people don't know what it is. Can you give them kind of the general overview? What is it? How does it differ from traditional dentistry?
Yes. So biological dentistry and traditional dentistry are similar in the way that we do treatments exactly the same. So we do fillings, we do gum health cares for the people, we do extractions, implants, all those things. The difference is that how we approach in diagnosing for the people, how we treatment plan for the people. So for instance, if someone comes in, they say they're suffering from, the Hashimoto's, or they are suffering from chronic fatigue. Then for me is, what's the cause of your chronic fatigue? What's the cause of the chronic illnesses that you have been suffering from? So then I look into their medical history, and then I ask them about their nutrition, and then I see, okay, then for your treatment plan specifically, I have to alternate what I'm going to be placing in and what kind of treatment should be undergone. So for instance, people with Hashimoto's, sometimes they'll talk to me, or people with thyroid problems, they'll talk to me, they'll say, what could be out there that's influencing my health from a dental perspective? Then I'll say, there's dental materials that we want to avoid for you specifically, like fluoride. Because fluoride, there are studies that shows that they do influence the thyroid function. They influences the pituitary gland function as well. So then for us, it's like, what's the alternative things that you guys can use? And I'll talk to them about it. And I'll tell them, there's supplements that you can take. Or I say, we'll work with your functional medicine doctor or your physicians. And we go on from there. And of course, for the people with chronic fatigue syndromes, then for us, it's more focusing on, do you have dental materials in your mouth? Do you have infections in your mouth that's actually contributing to those kind of problems that you're experiencing? And then from there, I say, okay, then how do we remove that for you? Are your body well enough to to undergo those treatments? If it's not well enough, how do we prime you to get your body healed a bit better so then we can have you undergo those kind of treatments and then taking care of you from a long-term wise. So we look at a lot of the cellular function, the dental treatment interaction with the whole body perspective. Okay. That's a little bit of the biological field.
Is it common that you find an underlying infection under a filling or implant or something for people with chronic fatigue? Is that common?
Like for fillings, like Mercury fillings, they do interact. The Mercury filling is amalgam filling, the silver ones that people have in their mouth. So that releases mercury, and mercury do have effect on the nervous system. So a lot of people, the chronic fatigue that a lot of people are complaining about that as we find mercury fillings in their mouth. There are people who say, I have headaches, unexplainable, it just won't get better. Muscle, joint aches, those kind of things. So when we realize it's there is that mercury that's in your mouth, we want to take them out. And also it can also influence the digestive system as well, because our mouth is the start of the digestive system. So as they're eating, as they're chewing, they're brushing their teeth, mercury vapor is being released, they're swallowing them, and it's going to go down to their intestines, right? And then that's the area where we're absorbing our nutrients. So it's all going to be influenced. So for us, it's when I see those patients, then I say, okay, then we have to take those out. And how do we do that?
So it's kind of like they're being slowly poisoned.
Yes. Yeah.
Interesting. Okay. Okay. I had heard a little bit about mercury fillings or amalgam fillings not being good for you. I didn't know.
Hmm.
Thank you. I'd never had it clarified for me, what exactly the problem was, but that makes good sense. Yeah, I know a lot of people who have Hashimoto's are very conscious with fluoride. So that would make
Yes.
sense as well, so many products. Interesting. Well, I saw on your website you referenced something called a SMART technique, and I believe it maybe had to
Hmm.
do with the removal of fillings.
Yes.
Can you tell us a little bit
It's a
about
removal
that?
of the mercury filling. Yeah.
Okay.
Yeah, so a little bit about it. It's basically what with the mercury fillings in the mouth, we know that okay, if you have anything warmer than your body temperature, mercury vapor is being released from the fillings. If you
Really?
have
Okay.
any mechanism like a brushing type of mechanism or anything rubbing against it, it also releases it. There's studies that
Hmm.
shows those kind of things. So once
Okay.
we know about it, then we say, okay, we don't want our patients to have those kind of exposures. And when we are drilling things out, well, there's gonna be times when we're gonna be touching the fillings. And when we're drilling
Okay.
them, we are rubbing against stuff. We're actively rubbing against those fillings, right?
Like
We try to
activating it.
avoid doing that, but it's
Gotcha.
bound to happen sometime during the treatment. So how do we protect them? Then the SMART protocol is what we use. We put barriers. We give them supplements to help to make sure that the mercury level that they're exposed to is dropped down to as low as we can for them.
Okay.
Yeah. So it's
Interesting.
like providing them with oxygen mask, giving them supplements, putting a rubber dam on them, preventing mercury vapor from landing onto their hair, their skin, their clothes, so that when they go home, they're not exposed to it again as they touch those areas.
Right. Okay. Wow. It really is like removing a poison. That's
Yes.
amazing. Okay. Gosh. Well, another question is I saw on your website you reference zirconia
Mhm.
materials. I've never heard of that. Can you tell us a little bit about zirconia in dentistry?
Zirconia material in dentistry is it's a ceramic material. It is very
Okay.
biocompatible in comparison to. So I have many patients who come to me. They have allergies or very sensitive to a lot of the environmental factors. So then we say, okay, what's more biocompatible for you compared to other things? We can undergo tests for those as well. Zirconia, so far, is what we, as a biological or holistic dentist, we noticed that it's the most biocompatible material out there. So then we use those for any crowns that we place, or we
Huh.
use those for the implants that we place as well.
Okay.
Yeah.
And is that a newer
And
material? I have not heard of that. Is this newer in the, what do you call it, development of dental
no, it's
technology?
a more being commonly utilized material. It's a new. It's not completely new, but it is a new. Yeah, it is in relativity. It's newer compared to the other materials, but it has been out there. It has been around for quite some time. Yeah, it's
Okay.
just that it's the things that's made available with it is more and more commonly used nowadays compared to
Okay.
before.
Very interesting. Can you share a story or two that you've experienced with a patient where they have had improvement by going by this holistic dentistry route, the biological dentistry? Kind
Yeah.
of a before and after. I like to think that story.
Uh-huh. So one of the more memorable ones. So of all the patients I've treated, so one of them came in, or a few of them came in. They have the titanium implant placed in, and they keep on saying that after the titanium implant placed in there, quite painful in the area, and it's
Mm,
not explained when they go back to the doctor, the oral surgeon, or their traditional dentist who placed it for them. They will be told that hey, everything is integrating well, nothing is wrong with the implant, the tissue looks good enough as well around the area. But
okay.
then they're saying that well, this pain is not normal. I'm not supposed to experiencing any pain. So without that being explained, so then they found me, so they came to me as well. And what I usually will notice that, hey, are you metal sensitive? Majority of the time they do have metal sensitivity. Like they react to metals really easily. So then I
Okay.
said, well, then it shouldn't be in there in the first place if you have that kind of allergy response or sensitivity. So then what will need to be done is, of course, remove the titanium implant and then we place a zirconia implant in for them. And almost all the time, the patient will say, yeah, that chronic pain that I'm suffering from, it's
Mm,
gone ever since that metal is being removed. And we do also know the metal has charges to them, and our body runs with electrical current. So
right.
we functions with those. So of course, that's with the metal placed into our body. And I'm not even going into details about how those titanium metals can influence the whole rest of the body, inducing that inflammatory
Oh,
reaction
I
as
have
well.
one. Now I'm all worried. Okay. Ah,
So, yeah, those are the things that, and then yeah, the patient will have. Sometimes the patient will even have like skin reactions because of the metal
really?
being placed in there. And then
Okay.
their skin reaction, their sensation will also be improved as well from there. And there's other, of course, other dental treatments that we have noticed that will also induce other problems for people. And of
Okay.
course, when our goal is, well, you're presenting with this kind of chronic illness or chronic sensation that just won't be resolved no matter what you do. Is it something that's dental related? And we find out for them any hidden infections, any hidden cause of those symptoms
Right.
for them.
Yeah, that's amazing. I never thought about, it makes perfect sense. Your teeth is a place where there could be an underlying masked infection. We don't think about it and it doesn't always hurt, if
No, no,
there's
it
not always
doesn't.
pain,
Yeah.
right?
Like
That's
infecting the jawbone, sometimes people don't feel anything about it. But then when I take a look, like with the either a cone beam CT or I look with the closer with their X-ray that we took, and I say, okay, there's an infection in your jawbone. Do you notice that? But a lot of people say, no, I don't even know that it's there.
wow.
Yeah.
And isn't that something that can be fatal? Isn't there a connection between the heart health and
Yes. So a lot of things like the heart health is connected with very strongly related to like the gum disease. Gum disease, people don't usually feel it because it's a very
right?
slow process.
Okay.
And usually the people by the time people notice that something is wrong is when the tooth is really loose, the bone has already resorbed away
So
from
it's
the
pretty
area.
bad by that point.
Yes. So, and then of course the pocket has been increased, is harboring bacteria for them. Those
Mm,
bacteria then can, of course, hitchhike into the blood system and then go to other parts of the body. So, heart disease is one of the things that can be put on a high risk when people have those kind of
mm.
problems. There's Alzheimer's diseases that's also
Really?
related to the gum disease health.
Oh,
There's premature birth, pregnancy can be influenced by that, baby being born with lower weight than normal that they should be,
really?
or respiratory diseases. Yeah, those a lot of things can be related to the bacteria in our mouth from the gum disease, for sure.
Wow. Okay, I'm going to ask you an off the wall question, and I hope you're not, you can roll your eyes at me if you want, because when you have chronic illness, you hear so many different things, right?
Mhm.
And they fall on the scale of like incredibly helpful to like totally should be in a fairy tale, right? And sometimes we just have to go through. But I have heard in some sort of like, herbal not herbal like healing realms, and I have had a lot of benefit from some herbal things, but like benefit of like swishing with olive oil. Have you ever heard that? Is that a real thing, or is that just like straight up wise tale?
No, I've heard of that, and I have seen patients improved. Like they, I would say, well, coconut oil, olive oil, they're both good oils to use with the oil pulling for the people. And usually, I recommend for that for the patients who are having like periodontal diseases because it does
Mm,
help. Yeah, but of
really?
course,
Okay.
there's the underlying things because it's not like everybody who has those bacteria in their mouth will develop gum disease. Well, what's
Right.
the cause of it? So then it's one of the things that can help, but will it be as helpful for people who has other root causes? Not necessarily, but it's definitely something that will be beneficial for people to use.
So maybe
So
like
I would
symptom
say
management as opposed to really fixing the problem.
yes. It's one of the things
Okay.
on top of it that they can do use at home to help heal their gum disease problem.
Okay.
Of course, the source of that gum disease has to be eliminated.
Right.
Yeah.
Right. Well, I'm glad to hear you say that. Thank you. And thank you for indulging my question because, I've come across that a few times and I always like to lean on natural things if we can. And then we need medical
Mhm.
intervention or dental intervention when we do. But, if you could use a natural oil as opposed to like a product you buy at CVS, right? Like why wouldn't you?
Right. There's so many things with the chemicals in there, and then the chemicals
Yeah.
interacts with the body. So that's why we always look at the cellular level of interaction of the things that we use in the dentistry and the things that we recommend for our patients to use, because you have to understand what's happening to the body with the materials, and you have to understand, well, does this patient is even a good candidate to undergo this kind
Right.
of treatment or this kind of material to be utilized at home? Yeah. So those are the
Okay.
things that's very important for them.
Yeah, that makes total sense. Yeah, I always just think of the analogy of a tree. Am I dealing with a leaf, a branch? Am I striking at the root of the problem? Am I doing
Mhm.
something that's going to damage my body and maybe it'll show up on the leaves, but really it's happening at the root level? You know?
Right. The
that
root cause has
question.
to be eliminated before the body can heal. And we
Yeah,
don't want to contribute to that. That's the whole
exactly.
focus. Yeah.
And make it worse. Well, are
Yeah.
there any myths that again, this is a new topic to me. Maybe everybody else in the world's heard about it. I was a little bit familiar, but not enough to even explain it to someone else, right? Are
Mhm.
there myths that you've heard that people have about biological dentistry that are not true? That, or there are things, that you've just general misunderstandings that you've heard that you'd like to clear the air about that, like, hey, this is what people need to know is true and not true. Has anything like that come across your
Just
radar?
there have been people mentioning about like the way that we practice is because it's different approach compared to the traditional dentistry. So a lot of times people will say, well, why would you do it this way? Like traditional dentists I've often seen nowadays is that, well, people are saying, well, they need root canals. They're recommended root canals by their
Mm,
doctor. And then for us, we say, well, root canal is not that good.
right.
And if we can avoid it, let's give the tooth a second chance. See if we can do the treatments to help save it. If it really do need something to be done because the nerve is no longer savable, then I explained to them, and then of course there are people saying that, well, you should save the tooth, and if we're doing all these things like extracting the tooth before, like not giving it a second chance, those are things that people will say, well, you guys are not doing it a good way for the patients.
Mm,
But then we're always saying that, well, we want to make sure that it's the things that we do that in the long term wise is beneficial for the patient's health. Like the
right.
root canal, what kind of, like, it's being a dead tissue, it harbors bacteria,
Right.
leading to other inflammatory reactions. So it's not that we're doing things just of no base, no scientific base.
Right. Of course.
We
Yeah.
are doing things with knowledge of, hey, these are the things that can lead to negative impacts for a certain group of people. Then we want to avoid doing, excuse me, doing that for them. So yeah, so there's quite a few myths of people of like, why do you do this? Why do you need to remove
Mm,
something like a good mercury filling? Why do you need to remove that? It's absolutely fine. Like the people,
mm.
the government has passed, the FDA says it's fine. Then we say, well, it's just that the things that we know of,
Right.
then we want to prevent that. It's not that it's not
Yeah.
that we just want to do some things just to, yeah,
It's the
just
reason.
to do it, but it's to fix the health problem.
Well, in the last 5 years, it's interesting you brought root canals. It used to be that I just naturally have bad teeth. Okay. I brush my teeth 3 times a day. I floss every day. Like I'm one of those people, I could not take better care of my teeth, but genetically, everybody in my family we have to spend a lot of time and money on teeth. It's always been a challenge. And so it used to be that I found that when I went to the dentist, I mean, they couldn't wait to do a root canal. It was like if that tooth looked bad, it was like pull it, root canal. And I have noticed in the last 5 to 7 years, dentists that are not biological dentists, like I would call them the Western medicine doctor dentists, right? Not the integrative dentists, are pulling back about root canals and kind of saying, you know what, we don't really want to do that unless we have to. And what you just said, that, there are some negative side effects that I think it's in like 20% of the cases that you get some, I think it's necrotic tissue, like dead tissue in there. I had never heard that before at all. And in the last 5 to 7 years, I've been hearing more of it like talked about by dentists. My sister works for a dentist, and it's like, okay, so now this isn't like fairy tale stuff anymore. You guys are acknowledging it and the conversation's happening, which I think is
Right.
good, right?
Yes, because we're working on to let the world understand more and more about, well, the interactions right there with from the root canal treatment. There's the negative impact that wasn't as realized from before
Yeah.
compared to now. Yeah. So yeah, so then there's people constantly talking about it. So then I do notice there's a positive impact that more and more traditional dentistry are finally realizing it as well, which is a good thing because we
Yeah.
want the more people realizing it, the better the community will be taken care of, for
Yeah,
sure.
the more people can get on the same page, particularly about the big things.
Yes, but of
Well,
course it's gonna be a challenge still because the way that we were taught, yeah, the way that things were has spoken about for like utilized the treatment way of thinking has been done for that many years. It's
right.
gonna be taking some time to
Yeah.
have it turned, for
And
sure.
how did you decide to go into on the biological dentistry, the holistic? What did
Mhm.
you start on that track to begin with, or did something kind of redirect you onto the more holistic path?
It's so initially when I was learning about everything in the school, the holistic side of things were not taught a lot. We were taught about the basic, well, how to do this kind of treatment, how do you determine it's needed, those kind of knowledges. So very basic knowledges.
Okay.
The one incident that pushed me into the holistic side of things, the integrated side of things, is the fact that my wife's health was, she's also a dentist. So
Oh,
her health took a toll when she was
oh,
close to the end of the dental school. There's unexplainable allergies she has developed. Like when I spoke to people, a lot of people don't know about this allergy. So she has allergy against sun. She cannot be exposed to the sun.
really?
Yeah. So then we
Wow.
were like, well, what's going on? Like, how come all of a sudden now, if you're exposed to sunlight, now you're having rash all over the places and it won't heal as fast as before. So every single time it's getting worse and worse for her.
Okay.
And when we go to the doctor prescribed her like different medicines. Well, put this on, take this. So then we say that, well, we want to find out the root cause. We want to know what's happening to her, but it's never
Right.
explained.
Right.
Yeah. And then she has a lot of other allergies, like lidocaine allergy, that people don't know. That a lot of the doctors that we spoke to, they're like, "Oh, lidocaine allergy. That's not
It's
an
very
allergy."
specific.
So yeah,
Yeah.
and then or she's her sensitivity to different medicines. So then we were like, "Well, how do we heal the body? How do we get rid of it?" Because she never had that problem before. So then
Right.
that led us into finding things more and more about. Well, there's this other world of medicine
Right.
that people don't know too much about. Yeah.
Right.
So then that's how I got into the holistic side of things. And then after I explored, I was like, oh yeah, there's also holistic side of the dentistry that people don't
Gotcha.
know too much about. And then that's when
Yeah.
I started exploring more and more and then saying that, okay, yeah, this is a better way of taking care of the body for everybody, not just, hey, band-aid this up. You're gonna be
Right.
fine. If it doesn't fix, well, take this pain medication and get rid of the pain for now. And then if it comes back, well, nothing we can do. No, I want to find out what can be done for the patient and
Yeah.
what's the cause of it. Yeah.
Fix the real problem.
Yes.
Yeah. Wow, that's amazing. Well, what is how's has she recovered from the allergies? Is that better now?
So
Did she
the
find some
sun
things out?
exposure is
Mm-hmm.
getting better, but that's
Okay.
still something that we're working on. If she's
Yeah.
getting better and better, we're trying to do the nutrition style to help it. But so far, it's still something that we're trying to figure out. And then we do have some sort of lead. Like maybe it's because of this one food allergy sensitivity that she may
Mm.
be having, and we're trying to find out and eliminate it from it. But yeah, it's still in the progress of work. It's
That's, yeah, I
yeah,
have a lot of food sensitivities, and I spent the last 5 years. I mean, 20 years ago, I even had the blood test done that shows, and that helped, but they just kept getting worse and worse. And it is like undoing a rat's nest. I mean, you find one and then there's a secondary, or this gets better. Yeah,
right.
I wish her well with that. It's a lot, kind of a life's work, but
Thank you.
as long as you're
Yes.
moving in the right direction, is
Yeah.
fantastic.
Yeah. It looks like we're moving in the right direction. Just that it's not cured yet. It's not completely healed yet for her.
Yeah.
So yeah, but at least you can go out to the sun a little bit more now,
Yeah,
and
that
with
makes a
less
big
coverage.
difference. Less coverage. And then
Yeah.
the dental piece is right. So you're like, I can check that off the box of
Yes.
we've got everything
Yeah.
there. Well, we're kind of running up on time. I wanted to ask you, do you have any final words? Anything you want to share with my audience that they should think about with regard to their own health, or if they're curious about finding out more about this kind of holistic dentistry?
Yes. So with well, of course, they can check up on my website,
And we'll
Seattle
have you
Dental
linked to the
Care.
show notes. Yeah.
Yes.
Tell them your
.com.
website. Yeah. Let us know
The
where they can find you.
seattledentalcare.com. So that's the website. There's few blogs that we share about, well, what's happening, what's the relation. Yeah, and then it also talks about the treatments, how we do things a little bit differently, so they understand. Well, yeah, there's different perspectives to help them figure out what's going on for their body as well, and what different materials, because there's a lot of things that we talk about how to treat the materials, what's happening nowadays with pharmaceutical world, with the way that things are being made in dental field. Yeah, so yeah, the things that we watch out for will be mentioned in there, so they can find out a little bit more
Oh, that's
about those things.
fantastic. Okay. So they can go to your website and learn more about the dentistry in
Mhm.
general and learn more about you. And
Yes.
I'll link all that below. Well, I can't thank you enough. Thank you so much. We spend so much time in the chronic illness space thinking about our bodies, our food, the pain in our joints, and sometimes our teeth, they don't get the focus they should, and acknowledging the role they play, and that some of the underlying things, cures to what you're experiencing could be lied just right there in your mouth,
Mhm.
removing something
Yes.
using a different material. It's amazing.
Yeah, it's an interaction. Our bodies are a little ecosystem. Everything is interacting with each other. From the mouth to the body back to the mouth. It's very closely interacted.
One connected system.
Yes.
Awesome. Well, thank you so much. Thank you for tuning into the Bouncing Back podcast. We'll be back in 2 weeks with more stories of strategies, success, and inspiration. And until then, keep bouncing back. Thank you so much for joining me on this episode of the Bouncing Back Podcast, Professionals Thriving with Chronic Illness. I hope you found inspiration and actionable takeaways to support you on your journey. If you enjoyed this episode, please subscribe, leave a review, and share it with someone who might need a little encouragement today. Remember, thriving with chronic illness is possible. You are stronger than you think. Until next time, take care and keep bouncing back.